Hi, I'm Tom Hoffman with 121 Media, and I'm here at InContact's user conference, ICUC 2013 in Henderson, Nevada. And I'm joined today by David May, Director of Contact Center for Lafayette at the Schumacher Group. And today, David and I will be talking about how the Affordable Care Act is influencing the approaches that healthcare companies have to take with respect to customer experience. David, thanks so much for joining us.
Thank you for having me, Tom.
So, David, for our listeners and viewers, can you tell us a little bit about the Schumacher Group?
Sure. The Schumacher Group is a physician staffing organization, and we staff physicians in emergency departments across the United States. We're currently in 26 different states and in about 200 facilities, and that represents about 90% of our business. The other 10% of our business is where we actually staff physicians in the actual hospitals as hospitalists. And what a hospitalist is, it's an individual or physician that actually takes care of you while you're in the hospital if your primary care physician is unable to go to the hospital that you're at.
Oh, okay, thanks. So, can you tell us also a little bit about your contact center setup?
Sure. Our contact center is set up in 2 locations, for number one, for redundancy. But our Lafayette contact center, it has approximately 65 representatives. And then our Dallas contact center has approximately 35 to 40 representatives, depending on the time of year.
Oh, okay, thanks. So we've been doing a lot of reporting and coverage on how the Affordable Care Act is affecting different types of healthcare companies with respect to how they are planning to approach customers' experience, or perhaps how they're already making some changes now. And as you're seeing it evolve, what are some of the changes that you're anticipating for the Schumacher Group?
Okay. Well, one of the changes we've already made, Tom, is that we've actually virtualized our 2 contact centers. A year ago, the Dallas office was primarily an inbound contact center, basically answering patients' questions about their statements or their bills that we send out to them. And then our Lafayette contact center was primarily an outbound contact center where we actually reached out to patients after we sent them out a couple of statements, and our primary mission was to get the patient set up on budget plans in order to make payments on their bill from our physicians. Yeah. And one of the things we did is we actually combined the 2 contact centers together. So we now have one medium-sized contact center that's doing both types of work. So the Lafayette representatives are able to take inbound calls based off the statements, that toll-free number that's on the bottom of our statements. And then our Dallas representatives are able to make outbound phone calls when the statement volume inbound calls falls down. Now, one of the things that we're looking towards 2014 is that since more people are going to be insured, individuals that have never had insurance before are now going to have insurance because they're required by law to have it. And we anticipate that they'll come into our emergency department, we'll send them a physician's bill, they're also going to receive a hospital bill, but they're going to say, why am I getting this bill? Because I now have health insurance, I shouldn't be responsible for this. Well, it's going to become an education that we have to educate our patients about the coverage that they have based on their explanation of benefits. A lot of them will not understand what a deductible is, what a copay is, because they may go out on the Affordable Care Act and go out to the website and buy the cheapest insurance they have. However, that insurance may have a $5,000 deductible that they have to meet before their insurance coverage kicks in. So we're going to have to educate them on that. We're also going to have to educate them on their copay. So if they go in the emergency department, their copay may be $250 that they have to pay, and then their insurance covers the rest. Right. They're just, some individuals just going to think that, hey, I have insurance now, I'm 100% covered.
Yeah, exactly.
Which is not true.
Yeah. So can you talk a little bit about, I know there have been some concerns raised in the industry about how, given the fact that millions of consumers will come into the market, some who are new healthcare insurance customers, others who are testing out the market and looking to see if they can get a better deal than they do through employer-provided plans. Can you talk a little bit about what this means in terms of what you need out of a contact center platform, in terms of ability to scale up and down with agents, or transition from one contact center to another as demand dictates?
Right, and that's the key thing for virtualization. That's one of the things we went through, and this year already we're kind of pre-planning for 2014, and basically through InContact we were able to blend the contact centers with little to no effort because InContact handles it all for us. And then also within Contact, they're coming out with a new dialer technology, which is their personal connections. And we're really looking forward to that because basically our representatives will log into the dialer and be making outbound phone calls. And then when an inbound phone call comes in, they're automatically going to suspend outbound dialing and move into that inbound channel to take that call. And then when they complete that phone call, then they'll automatically go into outbound dialing.
Right.
The current technology that we're currently on is where if you're on inbound, you take that inbound phone call, then you go available, then you have to log into the dialer and then make outbound calls.
Okay.
And so there's that inefficiency there right now.
Yeah.
But we plan on, we're going over to the new dialer platform effective October 28th. So we're excited about that.
So with outbound, is it primarily for collections purposes or for other needs purposes as well?
We don't really look at it as collection purposes. We talk about building our relationship with our patients. Okay. One of the things that we've realized through Echo, which is another product that we have from In Contact, is that we always do after patient surveys on whether or not we cared for the patient. And this is from the patient's perception. And when a patient has to call us, 88% of the patients feel like that our representative cared for them. When we actually make an outbound phone call to a patient, 96% of those patients feel like that we cared about them. So is it because we are making the effort to call them and help them resolve their bill? Is that the reason they feel like we care about them versus them having to call us?
Yeah.
And remember, these are the same representatives. These are the same representatives taking the inbound calls and the outbound calls, but we see that almost 10% more patients feel like we care about them when we actually call them.
Okay,
So,
that's interesting.
is that
It is. So as part of this too, I'm wondering, given your use of the In Contact platform, do you foresee opportunities, when you were talking about agent coaching and training before, about how to be able to handle these situations as people are calling in with questions about coverage and so forth? Have you anticipated how the platform might be able to help you in that regard?
Yes, actually, with our 13.2 release that In Contact just came out with this month, they came out with a Supervisor on the Go program, which is an iPad application that you download it to your iPad, and you can actually look at how the queues are doing, and you can actually even go in and look at what the representative has been doing on a by-minute basis. What status are they available to take phone calls? Are they in the outbound dialer? Are they wrapping up calls? You can see all that. And then the new feature also on this app is that you can actually monitor the representative from your iPad. So you can push, select, hey, I want to monitor this representative, I want to listen to their phone call, and allows the supervisor to have mobility out there on the contact center floor and actually be able to do side-by-side monitoring real time with the representative right there by their side.
Oh, okay, that's really interesting. So I'm wondering too, given your experience and what we've been talking about, recognizing that physician groups versus healthcare insurers, they have different goals and agendas, especially when it comes to addressing the Affordable Care Act. But are there words of wisdom that you'd share to them about how to approach customer experience? Some things that they might want to think about as they go forward.
Well, as far as healthcare goes, which at Schumacher Group, we always put the patient first. It's even in our mission statement that we always put that patient first. And a lot of times it's just us educating the patient and, explaining how their insurance programs work and how the insurance companies view, they always look at, what the fair market value for that procedure is. And that's what they say are their allowable charges. And a lot of the patients don't quite understand all the ins and outs of their insurance policies. And really we become the educators or the teachers. And a lot of times the patient will say, well, no, that's not what I was sold, or that's not what I'm paying my premiums for. They said they were going to cover 100% of my emergency room charges. So we will actually get the patient on the phone along with their insurance company on the phone. We'll take time out of our day to help that patient out because we want to be there for the patient today, but we also want to be there for them tomorrow. And we feel like that if we build that relationship, they're going to say, hey, I want to make sure I go back to that emergency department. I had a great patient experience there. And that's one of our main goals.
That sounds like a terrific approach, because I know from my own experiences and with my family that often if you are working with a physician and there's a question about a bill, they simply refer you to your healthcare insurance provider and they kind of pass the buck, if you will.
Yeah, and that's where we don't want to do that. We don't want to put the patient out there on an island and say, hey, okay, you go talk to your insurance company about this. We're not going to help you out. You know, this is the bill. This is what you need to pay us.
Right.
We don't want to do that to our patients. We actually want to help them. And in any effort or anything that we can do to help out that patient, we're definitely going to do it.
Okay, great. Well, David, thanks so much for your time today. I appreciate it.
Well, thank you for having me, Tom. I appreciate it.
Thanks.